Hi everyone, my name is Galiana. I'm currently a registered nurse on a med-surg surgical oncology floor, which is a floor that contains a few med-surg patients, but more on the oncology side. There are patients that come onto our floor who are admitted that have a diagnosis of cancer but are being treated for an ailment aside from their cancer. For example, a person has breast cancer, but she's currently being treated for pneumonia or whatnot, or they could be treated for cancer related pain on our floor as well. So, I wanted to talk to everyone about today about some sacred cows that we can change, especially in my patient population. Going back to sacred cows, even though there's been dramatic improvements in nursing research, medical research, many nurses continue to practice these outdated nursing practices that have sometimes been proven to be ineffective for care, unnecessary, and sometimes dangerous to the patient. Um, they're basing tradition instead of science, and these sacred cows are often practiced by nurses, and it's hard for them to veer away from these practices because it's just like embedded in their practice. So I'm here to, I guess, debunk a sacred cow that I think will be better off for nurses in my field of expertise and that can overall help the patient population on my floor. So we know that our goal is to keep patients clean. Not only will it make them feel better, it's the ethical thing to do. It decreases infections, but it's more how we're cleaning the patient. I don't know about you, but when I was in nursing school, in one of my skills classes, we were learning about bed baths. And we were instructed to use the bed basin, put some warm water, soap, get a towel, and just dip the towel and kind of just give the patient an overall head to toe bath. That's great for patients who are immobile. It's unsafe for them to walk to the shower, or they just don't want to get out of bed because they're feeling so ill or in so much pain that they want to shower in the bed. That's great, but what if how we're bathing these patients is actually causing them more harm than good? Yeah, sure, we're keeping them clean, but is it really sanitary? If you think about it, we're pulling these basins from the Omnicell. We're filling them with warm water, with soap. We're getting a clean towel and giving them a bath. That's great for the first time. But I don't know about you guys, but once we're done using a specific item for the patient, like a blood pressure cuff or a bed basin, we're not just throwing it away. That's staying in the patient's room for the whole admission. So what tends to happen, which I've witnessed, is the bed basin is put in the closet or on the counter, left to the bathroom, and it ends up being used as a storage. I've seen things such as eye creams, ointments, Mepilexes, Powerade, cereal. It just starts accumulating in these bed basins. And then when it's time for the next shower for the patient, everything's taken out, put warm water, soap again, and the cycle continues. So that's, to me, a perfect recipe for bacteria growth. Um, I personally think that's a practice that should be stopped. I'm not saying that the bed basin is bad, but you should kind of use your critical thinking when it's time to bathe the patient. Like I said, I worked on a surgical oncology floor, so a lot of my patients have ports, central lines, PICCs, dialysis ports, Foleys, whatever, you can think it. And that's a perfect recipe for a healthcare acquired infection. They can get CLADI, Class B. And at the end of the day, my goal is to prevent infection for my patient, and give them the best clean possible care that I can. So instead of using these bed basins, I personally think we should think of other alternatives. For example, giving a chlorhexidine bath. On my floor at around 4 a.m. on the MAR, a scheduled med technically pops up, and it's the chlorhexidine bath. We're supposed to bathe the patient with 6 wipes, and especially if they're a patient that has a Foley, a port, a central line, or whatever type of infectious loving thing. So I think these chlorhexidine baths are a cleaner way to clean the patient in those areas. Obviously, you can't use it in certain areas on the body, but it's a cleaner way instead of using something that can just accumulate so much bacteria. So I invite you guys to use these practices in your field or think of other ways that can be evidence-based on terms of cleaning your patients. And I invite all of you guys to look at this video and give me your feedback. Thank you.